This episode of the Pain Education Corner is sponsored by the Comella Foundation. The Comella Foundation is committed to relieving pain naturally using osteopathic healing principles. Here at the Comella Foundation, we envision a world where people achieve their maximum potential by being empowered with knowledge and skills to heal themselves and others. This information is to be used for educational purposes only and not to be construed as medical advice. If you have any questions or concerns, please consult a licensed healthcare professional. Hello, it's Bill, the knee pain guru, and welcome to the Pain Education Podcast. Today we have a special guest, Rose Pignataro. Welcome, Rose.
Thank you, Bill. Good to be here.
How are you doing today?
Doing well, thank you.
Awesome. Well, Rose, you help people with pain.
I do.
Would you share like your story, how you kind of got into the industry, into the biz, and brought you this far down your journey?
Well, I've been a physical therapist for a little over 30 years now. So my interest originally began as a physical therapist, treating people who might be experiencing chronic pain. And then I became even further involved with it later on when I went back to graduate school. I have a Ph.D. in public health, and within public health, some of the bigger issues are substance use or substance misuse and addiction issues that are heavily linked with chronic pain, and more specifically with lack of access to proper care for chronic pain.
Wow, 30 years. That is a true commitment to helping people, especially in public health, because that is no easy journey, I would imagine.
No, but it's extremely rewarding, and I honestly love it. So,
okay, could you give us a scenario? Like I could, in my mind, I can go through. Okay, someone's in chronic pain, and they get into the maybe prescription drugs, maybe other illicit drugs as a way of coping and managing with pain. Could you kind of give us maybe a stereotypical scenario as to how that path might go?
Well, a lot of the people that I work with have pain due to neuropathy. Very often that's as a result of diabetes or some other type of medical condition. And neuropathy, pain from neuropathy, nerve pain is extremely difficult. It's notoriously difficult to treat. And because of that, very often what happens is people get shuffled from one health professional to another. And as health professionals, we often are not humble enough to say that we don't have the answer. And so what happens is people get a prescription for one medication, and sometimes they get a prescription for another medication. And the providers who are prescribing the medications don't necessarily speak to one another. People who have chronic pain are often not educated in what some of the risks might be up front. And so what happens is you might go to see a health provider who prescribes a narcotic medication, and you take that narcotic medication because you've been advised to take the medication by somebody who you trust, who's supposed to be an expert in their field. So you begin taking the medication. The medication is not designed specifically for chronic pain, so it's ineffective. And because you're in chronic pain, you feel somewhat desperate. And so you maybe start taking more of the medication that's prescribed. And then you go back to the healthcare provider, and because of some of the legal issues and the prescribing restrictions, you're not able to get more of the medication that you're now addicted to. And so you're forced to go outside of the traditional pathway to obtain that medication. And that's how people fall into issues with addiction. They're, receiving medication from multiple providers, or they're unable to get the prescribed medication anymore. And so they rely on outside sources.
Oh my gosh. Okay. Wow.
And,
this is
it's a huge issue. And I think a lot of us have this bias or stereotype in our heads of what somebody who's addicted to medication looks like. And I can
Uh-huh.
tell you that those biases and stereotypes are very rarely the case. This is your next door neighbor, your grandmother,
Yeah.
one of your relatives who innocently believes that they're doing something that will be beneficial and then gets caught up in the cycle.
Mm-hmm. I could also see, and please correct me if I'm wrong here, that a person could go down that path that you just stated. They got neuropathy, chronic pain scenario, and they get a narcotic medication that isn't necessarily designed, and then they run out of the prescription. So now they're left to other means. There's another route that could potentially be they go to multiple healthcare providers and they get multiple types of pain medications for different diagnoses.
Correct.
That
And
go ahead.
I was going to say that that's part of the bias too, is that, if you speak to healthcare practitioners, often we have in our heads what, a pain personality might look like, or somebody who's a drug seeker might look like, and that this person is going from place to place and maybe not representing their condition truthfully. And very often that's not the case either. This person has significant pain. And is really just seeking a way of managing that, and in that search may go to more than one provider. So,
Oh my goodness. Yeah.
we've established that ourselves by becoming so siloed in our practice where, if you're seeing somebody and I'm seeing somebody, we may not speak to each other. And that
Right.
happens in healthcare all the time, where we don't have this patient-centered model where we're all part of the same team.
Got it. Okay. I'm all about a vision for solutions. I'd much rather have that conversation. It's like to go down that and complain about a system that isn't working, or to delve into that. I don't know if that would be a really valuable use of your time.
Mhm.
I also want to respect your professional position where you are as a physical therapist, that I don't want to cross a line in the context of this interview here
Mhm.
that would jeopardize anything for you. So I'm gonna dance between those two positions, and please tell me whenever I would cross either line
No problem.
with that. But I would love to hear your ideas, your vision, your hope as to how this can begin to change, not only from a practitioner perspective, but also from a patient perspective. Because I don't believe firmly that it is all on the practitioner.
Right.
There has to be an education component
Right.
on the patient or the client perspective, that they're coming to the table with a level of responsibility going, hey, Rose, this is what I got going on, and I've already explored this. How can you help me? So let's dialogue about that. I think that would be great.
Yeah, that's actually the part of my practice that excites me the most. Chronic pain is such an individualized experience. And so everybody's a little bit different. Even people that have the same exact medical diagnosis have a different experience of their pain. And so putting the patient at the center of any type of intervention or plan that we might come up with really is the key to success. And so, more of a collaborative approach like you're describing is really my hope in working with people with chronic pain. And also, as I work with my colleagues in some of the continuing education courses that I teach and here at Emory and Henry College, working with the physical therapy students to try to change our perspective on holistic and integrative holistic approach to pain that puts the patient in the driver's seat. So
now the tricky part, I work with clients with pain as well. The tricky part is when you have someone that is in chronic pain, it changes how they think.
sure.
It skews reality to such an extent that it's like, I don't know what I need, just take care of it for me. So there's a little bit of chicken or egg, like what came first,
right?
That leads them into this disempowered, helpless, hopeless place to begin with.
Mhm.
How do you see we could begin to chip away at that dynamic?
That's definitely a challenge. And if you look traditionally at the healthcare industry, we're trained as patients to take a passive role. And as providers, we're trained that we're the expert, you're the patient. So there's this artificial hierarchy there where, I will tell you what to do and then you'll do it. Um, and then when people don't do it, we blame the patient. The patient's not adherent. What really needs to happen is that we empower our patients. Pain is very disempowering. You're losing control over your own life. It creates all kinds of role disturbances. Maybe I can't do my normal work. I can't engage in the leisure activities I usually enjoy. It changes my social relationships with my friends, with my family. And so all of those things have to be part of the perspective of not only the healthcare provider, but the patient too. And so you need to establish first a collaborative dialogue where the person who's experiencing the chronic pain can tell you about their specific individualized experience. What's happening for them? What's the quality and the location of the pain? But beyond that, how has the pain affected all of these other areas of their life? And if they had one primary goal in seeking a consultation with me, what would that be? So that can kind of prioritize what I might suggest from my background as a good approach for us to start to investigate.
Like share that vision with the patient or the client as to
absolutely
what would done look like, what would living their life look like, and then kind of work back from there.
Absolutely. I mean, it's not always, it's hard for us because we want to solve everybody's problems, right? That's why I became a physical therapist. I want to help people. And it's hard sometimes when people have chronic pain and that there's not a whole lot we can do traditionally to completely eliminate that pain. But it is possible to live a very fulfilling and high quality of life with chronic pain. I mean, we know that people do that. And so, let's address and mitigate the pain as much as possible, but let's also talk about how the pain has affected these other aspects of your life and what types of strategies you can use to take back that control.
And what is your abilities and limitations as a physical therapist to be able to point people in a direction of maybe someone else that you might know to be able to help them? How does that, I'm sure that factors in some way.
Absolutely. I mean, physical therapists we have to be cognizant of our scope of practice, right? And so I never want to go beyond my training or my expertise. Even if it's permitted legally, there's things that I'm really good at and things that I'm not so good at. And so being self-aware of the things that are within your wheelhouse, so to speak, and things that other people are better at helps you create that integrative approach. So it may be that somebody that I'm working with needs to or could benefit from speaking with a psychologist or working with an occupational therapist. And so really creating that team approach is essential.
Got it. And I agree. What is your ability as a physical therapist, or like legally, let's say you wouldn't be able to say, hey, go see a Reiki practitioner or a energy worker or like there's got to be limitations, like legally, what you can refer to and what you are not able to refer to. And I'm trying to understand where is that for you?
There are definitely certain limitations. First of all, like state to state can vary based on the State Practice Act. And so here in Virginia, we have what's called direct access, and most states have some form of direct access where you can self-refer to the physical therapist. But then part of my obligation is making sure that I conduct a thorough history, do a thorough assessment so that I can identify whether or not this patient needs to see a certain physician or a certain specialist for further workup. Also, again, going back to that collaborative dialogue, finding out what's important to the patient. So there are certain restrictions, like I can't prescribe medication as a physical therapist. We have to be very careful about whether or not we're prescribing supplementations, or, like some kind of supplement, vitamins and things like that. Mostly because it can interact with people's prescription medications. And so that's usually better handled by another provider, although there are physical therapists that have advanced training in things like functional nutrition who can offer those services well. I also don't want to, I love my patients, but we don't need to have a lifetime relationship. And so right from the first visit, we should be thinking about down the line, how does this person take care of themselves? And very often that involves seeing maybe a personal trainer when you get into your independent exercise program. After I've done manual therapy, everybody can benefit from massage and body work. And so, can that person now get themselves on a regular schedule of body work that doesn't necessarily require the skill set of a physical therapist, but they would do very well with the massage therapist, say. So.
Got it. Is it, I know for me, I'm working with clients on the internet. I do primarily education and training. So I teach people how to get themselves out of pain. And I can't diagnose, prescribe, suggest, recommend, like none of that. I recognize that that's my limitation, but I can say, hey, Rose, if I had chondromalacia and I was dealing with what you were dealing with, this is what I would do. And then this way that give my client the choice of how that they can consider that. They consider that as an option that they might choose. Is that something that you're able to incorporate, or is that strictly in the note, the assessment and the history that you're taking with your clients? How does that work?
For me now, most of my practice also revolves around education and not so much the traditional physical therapy interventions like soft tissue mobilization, joint mobilization, et cetera. And so part of the structure of my sessions is that I am very heavily invested in something called motivational interviewing. It's really just a style of patient-centered communication. And so in the course of conversation, I'm going to be asking people that I'm working with, hey, what's important to you? Also, what do you know about the treatment of chronic pain? Because it could be that this patient or client has tried some of these things before or has read something, about Reiki or energy work or acupuncture that tells me that they're interested in perhaps pursuing that. And so then we can kind of talk about that together. It's coming from the patient. It's not my specific recommendation, but I can certainly read what they're reading and answer questions and try to clarify things and
interesting.
Go at it from that angle.
Yeah, I really like that. I like the whole term motivational interviewing. I think that's fantastic. And I think that it can be done, I'm sure, in a way that actually further empowers what the client/patient has already done as far as their work, which is going to open up a bunch of opportunities that they wouldn't even think possible, because they may be still in that how you were saying we're trained to be passive as patients.
Right.
And now you're like empowering them with that. Right. Oh, you did do research on energy work? And go down that line of questioning to discover what they may have already done work on.
Right. And the neat thing about motivational interviewing is that it's really applicable across diagnoses, different patient circumstances, and it actually comes out of addiction medicine. It was developed by two psychologists who work with people with addiction issues, Miller and Rolnick. And so really any practitioner, and even in your personal life, you can use motivational interviewing. It's about active listening and really reflecting back to people what they're saying during the conversation that might be important to them, so that it is more empowering and it allows people to discover what their own inherent traits are and characteristics, and strengths and assets that are going to help them address the chronic pain in a way that's meaningful to them.
And Miller and Rolnick
Rolnick, yes.
are
Rollnick.
great. We'll,
William Miller and Stephen Rolnick.
okay. We will include information in the show notes down below if anybody would like to do further research on that.
Yeah, they've written a fantastic book about motivational engineering. So.
Excellent. Awesome. Okay. How'd you get into all this? Like, what motivated you?
Well, I guess, a career as a physical therapist, first of all, and working with people who have chronic pain and then, don't have a whole lot of options. So trying to find better options for people. Also, honestly, getting a little bit frustrated, when you make recommendations and people don't follow them.
Mm-hmm.
I used to come from the mindset of, well, if you're not going to do what I say, then you're not going to get better. And now I think, like, if the person's not doing what I say, well, maybe what I say doesn't fit what their goals are, what their expectations are for our relationship. And so now coming back to that really allows me to have better outcomes, number one, and form a stronger relationship with clients, a better therapeutic alliance, which really helps enhance the outcomes there. And so there's less frustration for me and there's a better outcome. I also have neuropathy, which makes it kind of personal. Yeah. So there's that happened later in my career, but I have an autoimmune condition that has created neuropathic pain and allowed me to connect with a lot of other people who have the same condition or same kind of presentation and draw on their expertise. And so that recognition that people who are experiencing chronic pain actually are the experts, and we hold them up, but we help support them in their quest for better living. But they're the ones that are actually immersed in the experience and can tell us what works best.
Mm-hmm. And I'd like to go back a little further, if that's all right, because I remember. Football, I was 11 years old and I twisted my ankle, and it was just like my childhood ended at that point, because now I had a sprained ankle and they put it in a cast and I missed the entire football season. And there was just this feeling of being disempowered in the whole process. And that, a series of injuries, which led to my knee injury, which is how I got into all of this. I'm curious as to going back over 30 years ago, what was the thing that inspired you? It's like, oh, physical therapy, that is a thing that I want to do. I'm curious if there was some experience when you were younger, or it's just an interest you had, or something along those lines that motivated you to go in that direction.
I think it's kind of similar to the story that you just told. When I was a teenager, when I was in high school, I guess probably my sophomore year, I was about 14 years old. I got the acute version of the disease that I have now. And so when I was 14, I got something called Guillain-Barré syndrome, or GBS for short. And GBS is where your immune system no longer recognizes that your peripheral nervous system is part of you. So your immune cells start to attack all of the nerves in your arms and legs, and you get pain, you get weakness, loss of sensation. And so I had an extensive course of physical therapy, which really helped restore my activity level. And, by the time I entered college, I thought, wow, what a neat profession. I want to be able to do this myself.
Oh, that's awesome. I mean, awesome in the sense of it was motivating and inspiring for you,
Mm-hmm.
and you use that. What I really like about it is, instead of it disempowering you, you flipped it around. And I think that is a characteristic that is so valuable for those suffering and pain, is that we can use these challenges, these tragedies, these life pitfalls, and use them as a way of propelling us forward to do something better in our life. So I commend you for that. That's awesome. And you've been in it for 30 some years. That is even
Well, I love it. I tell our students all the time, physical therapy school is incredibly hard, but it's also really worth it in the end.
Thanks for tuning in to today's episode of the Pain Education Corner. If you have a special talent or skill to relieve pain and you'd like to become a guest on our show, visit us at thecomellafoundation.org/interview. Help us spread the word on eliminating pain and suffering in the world. That's thecomellafoundation.org/interview. Now, is there's continuing education in physical therapy? It's like you just don't go to school and then it's like you're done and you do physical therapy for 30 years.
Right.
You have done continuing education. Is there areas in physical therapy or specific types of continuing education that you've had a special interest in over as of recently or over that period of time?
Yeah, so my board certification is in wound prevention and management. And so that's kind of how I got into working with people who have diabetic neuropathy, because the diabetic neuropathy and the diabetes can cause really severe issues with circulation and tissue repair and tissue healing. But with that, as I started to get more involved in working with people with diabetes, the recognition of our lifestyle choices and the impact things like stress, nutrition, weight management, our dietary choices, all of those things, things that are really within our own personal control, if we're aware of them, have a huge value in terms of prevention, but also in terms of making things better. So trying to come at things from more of a holistic perspective rather than a traditional medical point of view, and working with people on things that they can change so that, if they do get sick, it's not as severe, and also trying to keep them from getting sick to begin with. So health promotion and wellness has been a huge focus for me. So
I like it. And let's talk about it from a practitioner standpoint or a professional standpoint, medical. Like we have this existing medical model where we're all professionals. We're not necessarily talking to each other. How can, or if you were speaking to those who would be open to hearing, how would you articulate to them their perspective tweaked a little bit to help their patients, their clients more?
I think we're coming around to it, but it's slow. So there's, yeah. So there's a lot of opportunity in the change in perspective from an illness model of healthcare to a prevention model of healthcare. And so, in addition to putting the patient at the center of things, really working with one another and respecting the value of other services. So educating one another. What does a physical therapist do? What does an occupational therapist do? What does a registered dietitian do? What's the scope of practice for an addiction specialist? So that we can really work together a little bit better. And also getting the community involved. So a lot of what I do here at Emory and Henry is work with the students on community and civic engagement, because that helps educate the public about what we do as physical therapists. And it also educates us on what some of the priorities are within the community, within society, so that we can be better prepared we can anticipate the need and we can start thinking about the best way to address those.
So in speaking to those other healthcare professionals, what do you think is their highest leverage? I always look at it like the Pareto principle or Occam's razor, like the minimum effective dose to make the biggest change. How do you see they could begin to move from that illness model to that prevention model where, is it studying other people's scope of practice? Is it networking more with people? Like, how do you see, what is the biggest lacking component you see that can make the biggest difference for healthcare professionals?
We need to stop being so territorial.
Territorial.
Yeah, I mean, if there's a personal trainer who has an exercise that's going to benefit the person that I'm working with who has chronic pain, then have at it. I shouldn't be saying as a physical therapist like that my skills are superior as a PT to this personal trainer. Same thing with, there's this big traditional back and forth thing between PTs and chiros. And so,
Okay.
just dropping the kind of letting our guard down so that we can speak to and learn from one another and not have these artificial boundaries between. Each profession does definitely have its unique skill set and its unique value, but there's a ton of overlap. And when we acknowledge that overlap and put it together in a way that strengthens the value of our services from the perspective of the patient, everybody wins. And so,
Yeah, I may I share my own personal experience with that. So there's a guy, I've been doing this 23 years since I blew out my knee, had the surgery, ACL reconstruction, 4 knee dislocations to get to that point. I mean, it was kind of a nightmare for me. And I had no intention of like going into knee pain as a business or an industry kind of thing. And I started studying on the other side of the surgery and the physical therapy. And they were saying, well, this is all we could do. And I loved martial arts. I wanted to get back into martial arts. And I began my own path, my own healing path, which involved osteopathically based style of body work and nutrition and a martial art component to it. And so I'm into this a good 2 decades. And then I see just came across it. It's called the Knees Over Toes guy, Ben Patrick. Have you heard of him?
No,
Awesome.
This sounds very interesting.
Yeah, very interesting. So this guy is along the lines of physical therapy, coaching, personal training. That is how I understand it. I haven't done a lot of research, but Joe Rogan did a podcast with him.
Okay.
And he went into the details of how he approaches strengthening the legs to get over pain and to increase performance in the body. And it's absolutely brilliant. I was listening to him and I was like, oh, I got that part in martial arts. And that's where the martial arts stopped and he picked it up and ran with it. And then there was this other component that he was bringing in, and it's pieces that I had just touched on, and he ran with the other side of it. And I was like, oh, that was absolutely brilliant in terms of how he put it all together and has done this where he's strengthening the intrinsic muscles, like I believe it's the tibialis, which is the muscle in the front by the shin, the hip flexor, and then the full body of the hamstring. And I was absolutely blown away by what he had to offer, which is completely different than how I approach it. So I had this little bit of like, who's this? That kind of thing. And when I really had an opportunity to slow down and listen to what he had to say, it was absolutely brilliant in what he had to bring to the table and offer. So I would say that I let down my guard, and it really opened up a whole new realm of possibilities for myself as well as a person. So
it's challenging to do that because I've worked hard to be a physical therapist, and my colleagues have worked hard. And like any medical specialty, there's a lot of education and studying that goes into it. And so some of it's a little bit of ego, like, I am good at what I do, but the recognition that I'm good at what I do doesn't mean that other people are not good at what they do. And you have to be open to that expanded perspective. Like in my own pain journey, some of the things that have really helped me are adapted yoga, mindfulness practice, dietary changes, things that perhaps were not part of my original education as a physical therapist, but certainly have value the more that I learn about them. And some of what I've learned comes from clients that I've worked with. When I say, what have you tried and what's working well for you? And then let's talk about what's not working well. Well, when somebody tells me that they're getting significant pain relief from their mindfulness practice, now you have my attention.
Yeah. And I'm of the belief and the mentality that the rising tide raises all ships. So if we hold that bar higher, not only for ourselves in terms of how we're showing up, that we don't have that scarcity mentality in terms of like, oh, well, you're my client. And if I let you go, you will never come back and no one else will ever find me. When we come from that place of just, it's like, I'm really good at what I do. And Rose is really good at what she does. And Ben Patrick is good at absolutely what he does. Then people are going to naturally gravitate to who they need the support from, just because, well, they feel free to go to who they need to.
Right. And that is part of that whole empowerment as well. If I have a relationship with a patient and it's not working for them, please, by all means, feel free to choose what's working well for you.
Yeah. And this, I think, is going to change the patient, training the patients to be passive. That's going to be a game changer for patients / clients in terms of how they feel. That it's like, oh, well, this isn't the only guy out here. Or the only person out here. I feel free to go and explore other options, because there may be more than one person that's going to be able to help me.
Right. And that's really part of it, making patients or clients informed consumers so that they can make the best choice.
I like it. I like it, Rose. This is great. It's good stuff. Let's see. You work with clients obviously in person.
No, actually, I don't. Partially.
Okay.
So all of my practice right now is through telemedicine.
Yes. All right.
And the reason for that is, obviously with the COVID pandemic and, clients who might seek my services are often immunocompromised. I'm immunocompromised, and just so for everybody's safety. And because a lot of what I do revolves around more so a conversation that I'm having, sort of like you and I are having right now, this becomes a good platform. And the other thing it does is that I'm not restricted by geographical location, to the extent that I'm licensed here in Virginia, but I'm also licensed in New York. So.
Got it. So I just want to make sure I'm understanding everything correctly. You would only be able to work with clients or patients in Virginia and New York, or that it is?
Correct. Yeah. Okay. Right now, the way that the law is structured, the physical therapist needs to be licensed in the same state as the client.
Okay. So for those that are listening, they would like help and support from Rose. You need to live in Virginia and New York at this time. At the time of this recording, which is, where are we? February of 2022. So that's subject to change. Now, for those that are in Virginia and New York, would they need a doctor's, like a prescription or a referral from a doctor in order to work with you? Or
it depends on the complexity of their condition. So both New York and Virginia have direct access to physical therapy services. Okay. But some of that should be at the discretion of the physical therapist. So if somebody comes to me and they have a relatively complex medical condition, I will want to be able to communicate with a referring provider so that I have information about certain diagnostic tests, laboratory results, those kinds of things. But if it's somebody, maybe like a lot of times, my dissertation was on tobacco cessation. Okay. So a lot of times I'm working with somebody who, their primary goal is to make a lifestyle change. So they want to speak with me about quitting smoking or quitting chewing tobacco, or, they need to maybe get some better idea of resolving their stress, things like that. So we can have a conversation about that without me making very large plans of care that require input from another healthcare provider, but in general, like people that do have diabetic peripheral neuropathy, most of the time I'd like to have some contact with the person that's managing their care, just so that that person is aware that I'm seeing the patient as well, and also so that we can talk about things like glycemic management, what their labs are like, if the lab changes, the lab results change at all with changes in lifestyle like diet or exercise.
Now, and this, I just want to understand, because are you able to speak with people outside of Virginia and New York in a different capacity, or is that like, help me understand those?
Yeah, as a physical therapist, once you have a professional license, like I also have a certification, as you'll see, like CHES after my name, that's a certified health education specialist. So if I only had the CHES, I could speak to you.
Okay.
But because I have the physical therapy degree and the physical therapy license, that takes precedence. And so I have to adhere to the legal guidelines in the state where I practice and where I'm licensed.
Understood. And I really appreciate you breaking this down for me, because I work with clients, Australia, New Zealand, all over the place. And we've been, anyhow, I just want to understand. So awesome. So what we'll do is we'll make that distinction below for anybody that is interested in speaking with you. We'd like to put a button down below that they click on, and it brings up an email where they can shoot you an email directly to speak with you, or to set up a time to speak with you. And that would only be at this time, February of 2022, for anyone in the state of New York and the state of, or the Commonwealth of Virginia.
Right. But the neat thing about being a physical therapist is that we have a huge network. And so there's a health promotion and wellness special interest group. The American Physical Therapy Association, as our professional organization, actually has a website called Find a PT. And so if there are people in other locations who are looking for a physical therapist who does a similar approach that I do, I can help direct them. So
got it. So this, would you, and I just want to respect your time, all that, because we can get bombarded on the internet. Would you like to put the Find a PT link on below? And
yeah, that would be great.
Okay, Find a PT, and we'll make sure that's in the description box below. So you aren't typing in Find a PT for people around the country. Awesome. Rose, this has been fun.
It really has. This has been wonderful.
I've been enjoying with you. Yeah, just kind of picking your brain to see how the PT world operates and functions. And this has been absolutely fascinating. And you have definitely changed or opened my perspective in a lot of ways in terms of how physical therapists operate. So that is very exciting for me. I like that. That's awesome. Is there anything else, any of the topics that we talked about today, touched on today, that you would like to put a bow on, or something that I hadn't quite asked, you would have liked me to ask more about?
I don't know if in the audience there are other healthcare practitioners who are looking for training in that integrative approach to chronic pain, but I work with another physical therapist. His name is Dr. Joe Tata, and he has an organization called the Integrative Pain Science Institute. And I teach for Joe through the Integrative Pain Science Institute. I teach the class on motivational interviewing, but there are a ton of really awesome classes through IPSI, like a functional nutrition course. There's a mindfulness, trauma-informed care. There's a lot of really excellent courses. And of course, I think my class is great, but there are other classes that are also really great. And so, if somebody's a rehab professional or a health coach and they're interested in learning more about that integrative approach, that would be a good place to look.
Awesome. And this Joe Tada's name has come up a couple of times, so I think if you could connect me with him, that would be wonderful.
I'd be happy to make the introduction. He's
Awesome.
He's definitely an innovative thinker. So.
Nice. Well, that's fantastic. I think the more we have of education and training and raising the bar and dropping the ego and raising the bar at the same time to help people, I think it's really going to make a big difference across the board.
I would agree.
So we will absolutely put that link to the Integrative Pain Science Institute. Is that Institute down below as well to promote that, because it's all about how we could help more people. And excellent. It's fantastic. Rose, thank you. Thank you once again. This has been fantastic. All of that information will be down below on how to contact Rose and information on Integrative Pain Science Institute and the other information that we had during the call today. I took some notes, but thank you. Thank you so much. I really appreciate your time, your expertise, your sharing your knowledge and wisdom with us today.
Thank you, Bill. It's really been a great experience.
Cool.
I appreciate it.
Excellent. Well, I'm going to wrap this up for now. This is Bill Paravano, the knee pain guru, on behalf of the Comella Foundation and the Pain Education Podcast. Appreciating you very much for being here. Have a wonderful day, and we will see you on the next one.
Thank you, Bill.
Thank you for tuning into this week's segment of the Pain Education Corner. Join us next week for another conversation on natural healing methods to eliminate pain. To learn more about the work we do at the Comella Foundation, please visit our website at the Comella, COMELLA, foundation.org.